interesting kidney 3 spot. We talked about this kidney 3, right? So instead of right here in this empty sort of hole, I like to start kind of down here on kidney 4 and go into kidney 3 like that. So we will do that, and she's got some interesting veins over here. Anything to treat in particular now?
Well, I always have neck stuff.
Oh.
Just, well,
Like in the front?
I get tight scalings.
Tight scalings, that could be what's happening here, or it's unrelated, but either way, it's interesting to see it. I would like, there's almost a little nodule right here on this edge of the calcaneus. See it kind of bulging up right there? So that to me would be like if somebody had like a lymph issue, I would like check, it would look like that basically. It doesn't mean she has a lymph issue, but if someone did have a lymph issue, I would look for something like this in this area, which would be the, yes, needle that. The kidney 6 point, normally kidney 6 is right here, right in the dime slot, but we're going to go under and a little bit forward and put it here and go deep at an angle like so, and the needle will go, you know, over to there, not come out over here, but it would go to the opposite side of the foot, but at that angle. The liver 4 spleen 5 point tibialis anterior tendon goes here, right? We can see our tendon, so we're going to come to the inside of it, medial in front of the malleolus, and we're going to insert here and go towards stomach 41, and that could be a couple of different locations. We're going to just do one in the middle to show it. And then the bladder point we'll do on the other foot maybe so we can see that. So those are our spots we're going to do to start with.
What gauge is this?
These are 38 gauge, 1.5 inch.
That's the gauge you usually use for threading or for
It
everything?
It is, everything. Mm-hmm.
Okay.
Yeah. Unless I'm doing Bali points, then I go deeper. But even scalp, I use that.
Wow.
Yeah. And I like to tent a little bit, so maybe we'll do like a liver 5 to show the tenting a little bit like this. Just squeeze the tissue a little bit to get a little space. Lung 7, 8, 9 are another good version of that. So the 4 is about here, the 3 is over there. We'll start about here. Right? There's our insertion. It often goes too deep using a tube, so I always back the needle up a little bit because I just run right into tissue, right into bone. So I back up a little bit so it's just under the skin. And then we're gonna, until the needle's pretty floppy, like that, so it just dropped. So now we can go at the angle I want to get into kidney 3, like so. And that's kidney 3 for me. So I need to let that direction.
Oh.
So the needle ends up
Yeah.
way over there, right? Yeah. It's okay?
Yeah. I can feel
So
it.
you do
It
that
didn't
because
hurt.
it's more,
I get more chi on it that way.
Right.
Mm-hmm. I don't think the direction matters, but I can't figure out how to needle it this way and get that because the curve goes in and this comes out, so it's in the way. The same thing, you do the same thing with bladder. So you start onto the talus and then go calcaneus and then go into 60. But before we do that, we'll come down here to kidney. There's the high 6. This is low and a little bit distal 6 about here.
so this is kidney 6 demo.
This is kidney 6 demo, right? And we're gonna go, so the bone here is curving like this. So we're gonna, if we go straight in, we're gonna run into it. If we come to this side, we can go along the talus. So we're gonna go, I'll show you both. So she got a little bit of a reaction there. That's not as deep as I want it. I'm gonna let it calm down, otherwise it just blows people away. So as soon as that doesn't feel like anything anymore,
That's okay.
then we're gonna go, we know that it's reacting already, so we're gonna go nice and slow, and we're trying not to have the chi come right to it because we want the depth, right? So we want the depth, so we're gonna go slowly, 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 slowly. And right there I've run into talus on the backside. Probably it's actually one of these bones over here. So that's where I want it. So now if I want to bring chi to it, is there anything
I
on that?
can feel it.
You're feeling it, so we'll just leave it. If she was having menstrual cramps, I would expect them to go away immediately.
With
It's-
those two needles.
this one only.
Okay.
Might do it bilaterally, probably would, because they're right in the middle.
Right.
But usually I will do just that one. Sometimes one side's enough. Usually it's both. And then if she wasn't getting enough, I would start rotating the needle. I wind it. That's how I like to get the chi at the needle, is I wind it. So I turn it one direction until the tissue grabs the needle. and then during the treatment it relaxes itself. And I don't have to, very rarely would I have to unwind it to take it out. Usually it unwinds itself. The needle isn't moving, the tissue that grabbed it has let go, and that to me is the treatment happening. Not on every point, but on a point like this where I want a specific depth and then I want the chi. That's how I do it. Okay, so there's that one.